Thanks, Chip. Well, National Infant Immunization Week is coming up, and Lauren Hawkins from the Chattanooga Hamilton County Health Department joins me to give us some important information. Great to have you here today.
Good to be here.
And this is not only, this is like almost a global incentive, right, to really promote public health and good health, right?
Yes, it is.
Very important week.
A national campaign to raise
Right.
awareness to help protect infants from vaccine-preventable diseases through immunization.
Right, because it is so important. And you said that there's a critical time period kind of there, and it's from like 2 months to 2 years, right? There's some important ones
Yes,
that
they
need to be
receive a
given.
lot of doses during that time period, and it's very important to protect them. There are actually a couple of immunizations that they receive that protect them, particularly under the age of 5, and that's the Hib vaccine and the pneumococcal vaccine.
Okay, because a lot of times I think, you hear of these diseases and we think, well, it's just they were way in the past that these things occurred and happened, but they really can still affect children. There are still cases, and that's why these are so very important, right?
Exactly. We have seen outbreaks, and so definitely it's important to receive those vaccines to prevent those as much as possible.
Okay, so there is a whole list. What is the best way to educate parents? Maybe if there's an expecting mother, because you said there's even some vaccines even when you are expecting that are important, right?
The best way is to talk to your healthcare provider. So whether it be your child's pediatrician or if it's a pregnant woman, their OB provider or primary care provider.
Because there's a whole list, and we've got that chart there. I mean, that's a lot for a parent to. I remember I have 3 children of my own, so I've been through this, and I remember getting that little chart and kind of, looking through to see if we were on point ourselves. But it is overwhelming. I was constantly going and having to ask, the doctor, are we good this time? So
Definitely.
That's kind of the recommendation there, though. Take us through that.
So really starting at birth even, infants can receive the hepatitis B vaccine in the hospital at birth.
Right.
And then from then on, usually at the pediatrician's office or the health department offers vaccines as well. They receive doses of the DTaP vaccine, which protects against diphtheria, tetanus, and pertussis or whooping cough. That's also the one that's important for pregnant women to receive. Their version is called Tdap, but it protects not only them from whooping cough, but also their infants. So we recommend that pregnant women receive that with each pregnancy.
Right, and I know, like I said, as a mother, I remember even, my first one, getting that in the hospital. I think he did actually get, and it's kind of a scary thing. And, you hear different things and different concerns out there, about vaccines being linked to maybe other diseases. There's just so many, I guess, kind of anxieties, especially for a first-time parent. So what would you recommend, what do you guys do to kind of help ease some of that anxiety?
Well, we talk through it,
Right.
definitely addressing any concerns that the parent may have, and there are lots of studies that have been done, so we discuss that at length as well, and the pediatricians in this area do a great job with that as well.
So what do you all try to do during this week? As you promoted, it starts, I believe, on Saturday. This week actually kicks off. So tell me, kind of take these through this week and what you guys do to promote it. Obviously, you're here today to promote
We're here
that.
today, and
That's
we
right.
definitely have signage all over the health department. We did a Facebook post about kindergarten registration coming up, so we're starting. Lots of those kindergartners have siblings that are infants, and so we're getting them as well.
Yes,
and
because before you can even start, I guess, daycare, kindergarten, preschool, you have to have those vaccines, right? And you don't want to get too far behind, because then you're kind of in catch-up mode if you have fallen behind, right?
Yes,
So
then you have to see us a little more often.
That's right. And with the flu, really quickly, we've seen some cases even in the spring with the flu.
Yes.
Now, you say infants, though, that are, is it under 6 months, are not recommended to get the flu
Not
vaccine?
recommended, but we do recommend that their families receive the flu
Right.
vaccine to help protect them as well.
Especially if they have those older brothers and sisters, those older siblings that are in the
Yes.
school system. That is so very important. Well, if parents are seeing this, still have questions, and maybe they know that they maybe are behind on some vaccines, what websites can they go to kind of get that same information, that chart that we just showed?
They can go to the CDC's website, so the
Okay.
Center for Disease Control.
Right. And I've got your local phone number there from the Chattanooga, Hamilton County area as well.
Yes,
also
and
contact you.
health.hamiltonpn.org.
Perfect.
We have a link to our immunization page right on the homepage.
All right, great. Thank you so much for being here with that important information. And we'll be right back with more Let's Chat.